Welcome back. We're now going to talk about the Associate Physician license in British Columbia. Now, the Associate Physician license in British Columbia is a very interesting license because only British Columbia has Associate Physician license, okay? Now, the Associate Physician for many, many years was only one license or one type, but recently British Columbia has divided it into two types. So you can have the Acute Care, which is the one that was previously most known for, and number two, you can have one that is called Primary Care, okay? Now, the requirements that you need to have for each of these are different, okay? Some things are the same, so both of them will require the MCC QE1. So both of them will require the QE1. However, for the acute area associate physician license, you will need to have 2 years of postgraduate training. So this license is really good for specialists that did more than 2 years of training, but they might not have all the years that are required to go through the Practice Eligibility Route, which is a specialty pathway for specialists. So if you apply for the acute area, 2 years of training or more, you're able to apply for this license, okay? So you need to have 2 years completed your medical school in an accredited medical school, which is normal. You have to have done 2 years of postgraduate training, and then you're gonna apply for the license with the College of British Columbia. Now, the currency of practice is the same as the practice ready assessment, which means that you need to have practiced independently for 960 hours in the past 3 years, okay? So that is a requirement, 960 hours in the past 3 years. For primary care, however, this is like a new license that didn't exist before. You can have done only 1 year of postgraduate training. So you don't need to have 2 years of postgraduate training. You can have only one, such as, for example, an internship. They do outline what are the rotations that you need to have done, and the currency of practice is the same, okay? You also need to have an English proficiency test, as I mentioned before, that all licenses will require this, okay? Now, in the primary care, your training has to be a training that you did as a general practitioner, okay? This is very important. And then after that, you will submit your application, and once you secure a letter of sponsorship by the province or the health authority, the health match, they will help you see if there are any job openings that you would be able to apply for, and then they will do a full assessment of your credentials, okay? So what is good about this license is basically the Acute Care Associate Physician is a license that is for specialists that don't have maybe more than 2 years. If you have 2 years of training and you're not a specialist, then you can do the practice ready assessment. But if you are a general practitioner with only 1 year of training, you can now apply for the Associate Physician Primary Care, which is very similar to clinical assistant in the other provinces. It's just that it's not called clinical assistant in British Columbia. So in British Columbia, it's called Associate Physician Primary Care, okay? So this license is really good for people who are starting. It's excellent to get experience before you apply for a residency program. You get to know the Canadian healthcare system. You get to do physical examination. You're seen by your supervisor by direct observation of your clinical skills. And they can usually write very strong reference letters that might actually be a game changer when you're applying for a residency program. So I always recommend for people that are applying for residency that if possible, they get a job as a clinical assistant while they are applying for residency. And this is one of the licenses that you can now apply for. And until very recently, there was no way to apply for any license in British Columbia if you didn't have 2 years of training. But now, since this primary care license became available, you're able to apply for this primary care associate physician license as if you were like a clinical assistant, just with 1 year of postgraduate training and 3 years of experience, okay? So this license, as I said, offers some opportunities in BC. Your salary range is between 80,000 and 150,000. I know that's a big range, but it will depend whether or not you are in the acute area associate physician or if you're a primary care associate physician, okay? So now that we talked about this, I will go on to talk to other licenses in the next videos that are also in BC. If you have any questions, remember to leave your questions below, okay? I'll see you soon.